Miscarriage is a term which brings lots of sadness to any family. Miscarriage is loss of life at a very early stage, in the early stage of pregnancy. Now it is true, we reassure these women by saying that you haven't really lost an organ, so you can conceive again, and maybe in the next pregnancy you're not going to lose the baby. But there are rare situations where these women have many miscarriages, like one after another miscarriage, what we call recurrent miscarriage or recurrent pregnancy loss. So in the early part of pregnancy, without any reason whatsoever, suddenly they have bleeding, they have pain, and they lose the pregnancy. Sometimes there is no symptom at all. When they come for ultrasonography, it's shown that the pregnancy has stopped growing, what we call missed miscarriage. Now, in majority of the cases, miscarriage, we find some cause or other, but in small minority, we do not find any cause. The causes are fivefold. First, it could be some chromosomal problem, some genetic problem from the husband or wife. So the sperm has some defect or egg has some defect, or maybe the sperms and eggs are healthy, but when they are joining together, there is some chromosomal abnormality, some genetic abnormality. So nature doesn't want abnormal babies to be born. So these pregnancies are stopped by nature in the form of miscarriage. The second cause is infection. There are many infections which can cause repeated pregnancy loss. The third is hormonal imbalance, thyroid problem, prolactin problem, excess LH like in PCOS can cause miscarriage. The fourth is clotting problem. Many a time we find there are small blood clots formed between the circulation of mother and baby, and this is called anti-phospholipid antibody syndrome. And finally, there may be some structural problem inside the uterus. Uterus has got a like partition. There is some tumor inside the uterus like a fibroid, a polyp, or there may be some adhesion, so the uterus cannot grow. Maybe the cervix, the neck of the uterus is loose, so as the pregnancy grows, suddenly the mouth opens, the neck opens, and the lady loses the pregnancy. Now we have different tests where we can identify the cause of this problem and they can be treated. Now it has been said that even in those cases where we cannot find any cause, if we give supportive therapy to this patient, lot of sympathy, lot of compassion, then the success is inevitable. So it is said the best treatment of recurrent pregnancy loss is tender loving care, or TLC. So if any of you have gone through the sad experience of recurrent pregnancy loss, please visit a specialist obstetrician and gynecologist who would do some investigation to find out the cause, and it can be treated. We have treated women who had 7 miscarriages in the past, and she conceived and delivered successfully healthy baby on the 8th attempt. So there is nothing to be worried about. There is nothing that we cannot solve. It is up to you to come to a specialist, investigate yourself, rather than be very sad and depressed and keep it within yourself. Don't get demoralized. Recurrent pregnancy loss is a problem which can be treated.